There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: what foods help lower high blood pressure? Answer by Kunwar Bir Singh. High blood pressure, or hypertension as it called in medical terms, is considered as a lifestyle disease as various factors come together in a person to bring up the blood pressure. So the management of hypertension also needs to consider multiple things. Sadly, there is no magic cure for high blood pressure, and controlling blood pressure needs effort in all areas of life, including adequate sleep, managing stress, regular aerobic activity up to 150 minutes a week, maintaining weight in a healthy range, and avoiding activities like smoking, excessive alcohol and caffeine intake. As the question asks about the food, now I will focus on that. There is no single food which can help us control blood pressure, as we need to maintain a balanced diet in order to bring our blood pressure under control. The foods to consume: there is no single food which can help you to control blood pressure, but rather a well-balanced diet which can help you to manage your blood pressure well. The best part is that the same diet plan can also help you if you have diabetes, cholesterol and heart problems. These diet plans have been well studied and researched, and evidence is emerging that these may lower the risk of stroke and heart problems. First is known as DASH diet, dietary activities to stop hypertension. More about the DASH diet here. DASH diet: healthy eating to lower your blood pressure, Mayo Clinic. Another diet plan which can be followed is Mediterranean diet for heart health, Mayo Clinic. Both these diets have scientific data behind them and are really proven to be effective. Both these diets have many common points. Low sodium salts, not so healthy as they are marketed as. Most of these salts are marketed as healthy alternative, as they contain potassium, which can actually help to lower your blood pressure. Usually these salts do not have the same saltiness as the normal table salt. So unless you are using it in same quantity as the normal table salt, you may end up having similar sodium intake as before, as you will be adding more to compensate for less saltiness. So you end up paying more without getting any benefits of lower sodium intake. Foods to avoid: most of the time, cutting down on unhealthy foods can help to bring down the blood pressure. The list includes: the most important thing, blood pressure is called silent killer, as it does not cause any symptoms unless the complications have begun to appear, by which time it may have caused enough damage to the body, which is usually irreversible. Diet and lifestyle is an important aspect of managing hypertension, so please follow your doctor's advice and follow up on your medication regularly. Many patients will be able to reduce the medication on following the advice, but the effect on every individual is different. Do not take blood pressure lightly, it kills slowly. Please let me know if you need more information. As this is my first attempt to answer a question on Quora, please forgive if the answer seems a bit off and not so flowery like other good answers. Answer by Angela Kunis. While most traditional fruit juices are laden with processed sugar and practically devoid of useful nutrients, 100% pomegranate juice is actually one of the healthiest juices on the planet. Video: blood pressure exercises vs LCB. With the exceptions of olive, coconut and sesame oil, I generally try to stay away from vegetable oils. However, the oil of sesame seeds has been popular in ancient medicines for millennia and has some serious heart-healthy properties. Unlike most of the foods mentioned above, there are a few minor risks to consider when consuming hibiscus tea, although it's generally recognized as safe. There is some evidence that at extremely high doses, hibiscus tea could potentially interfere with some liver functions. 52. To avoid consuming an overload of nitrates, first, do what you can to maintain an alkaline environment in your body. Second, buy organic whenever possible to avoid unnecessary nitrates from pollution and pesticides. It's interesting to note that although olive oil doesn't contain adiponectin, it helps increase the amount of adiponectin found in the blood without increasing inflammation. 61. These foods are all parts of the dietary approaches to stop hypertension diet, also known as the DASH diet. I am generally a fan of the basic tenets of DASH, with the exception of an insistence on low-fat dairy, which I'll show you in just a moment. Following a heart-healthy diet like DASH is good for more than just your heart. Eating these foods and other DASH foods reduces your risk of cancer, heart disease, diabetes and all-cause mortality. 62. 63. As you look at each of these specific foods, you'll see that many of them, including pistachios and sesame oil, help improve what is known as endothelial dysfunction. 64. 65. This is a broad term for a physical response that involves an imbalance between the substances affecting the inner blood vessel lining. Endothelial dysfunction is a predictor of heart conditions like atherosclerosis. 66. On the subject of dairy, the DASH diet suggests consuming low-fat dairy products, which is not something I usually recommend. Low-fat dairy products often have higher levels of sugar than their full-fat counterparts and are actually associated with obesity and type 2 diabetes in some people. 69. 70. Since healthy fats are important for proper bodily function, my advice is to eat raw, fermented dairy from organic, grass-fed goats or sheep if you can find it. Coconut milk and almond milk are easier to find alternatives. If you want to keep drinking cow's milk, always go organic and try to find milk from Jersey or Guernsey cow breeds. Otherwise, try the non-dairy healthy fats that will keep your ticker running well. Answer by Ray Schilling. Reference, Rev. 1. Nathan S. Bryan, Ph.D. and Janet Sand, OMD. The nitric oxide, no, solution, Neogenis, Austin, Texas 78746. Copyright 2010.